Yeah. I call the honourable member for Gellibrand.
Thank you, Mr Deputy Speaker. At the last election, those opposite pulled one of the biggest bait-and-switch operations in Australian political history. Australians know from the former member for New England that the Prime Minister was willing to do and say anything to get into office. Australians heard his promise on the night before the election, quote, "No cuts to health, no cuts to education." And after $80 billion of cuts to health and education in last week's federal budget, Australians now know that they can never trust a word this Prime Minister says to them again. Because the bait of a benign Tory government that would protect funding for our hospitals has been switched now for a hook, ripping billions of dollars out of our health system. It's an understatement to call these changes cuts, because this isn't temporary pain that will heal over a period of time. The federal budget is a shotgun blast into the Australian healthcare system, and one from which it will not recover easily. The impact in my electorate will be felt by all the residents of Melbourne's West. Western Health, including the Western Hospital in Footscray, the Williamstown Hospital and the Sunshine Hospital, stand to lose more than $58 million from national health reform payments alone. This funding is used to deliver emergency department services and admitted and outpatient services in these hospitals. The result of these cuts will blow out waiting lists of people in Melbourne's West and, like the Victorian state government recently delivered by Dennis Napthine, will leave sick Victorians on their own. The Prime Minister's healthcare deceit can be further seen in the $7 GP tax. After years of telling Australian people that Medicare had no better friend than Tony Abbott, we now see the truth of the situation. Well, I've got a message for those opposite. Australians didn't vote for this and they don't want it. The Australian people are no fools, and you'll pay at the next ballot.